very good evening to all. I am Sharmishta Majumdar, a PhD scholar from IIT Jodhpur, and I am your PMRF TA for the course Maternal Infant Young Child Nutrition, which is being taken by Dr. Rupal Dalal from IIT Bombay. Is my slide visible? Could anybody please confirm?
Yes, ma'am.
Okay, thank you. So, today we'll be going through the topics that you must have come across in the lectures in week 4. So, the topics which have been covered are the first 1000 days, the essential nutrition action for pregnant women and for children. We have also come across the importance of iron, vitamin C, and sulfur, and you must have also read about the different recipes made with different iron rich sources, vitamin C rich sources, and sulfur rich sources. So, in this problem solving session, I will not be discussing about the recipes, but of course we'll be knowing about the some of the very important topics related to the importance of iron, vitamin C, and sulfur, apart from the basics of the first uh, how the development, the brain development, and the growth occurs in the first 1000 days, and also what are the essential nutrition factors which are required for pregnant women and children in their early days. So before moving on to the different problems, I will be yeah. So before moving on to the problems, I will be discussing some of the queries that many of you have raised in the portal. So let us start with query number 1. So one of you have asked regarding scurvy as to what scurvy is, and you have asked about its details and explanation with details. So, before moving on to the particulars of scurvy, let us know a little bit about vitamin C. So, vitamin C, also known as ascorbic acid, as we all know, it is a water soluble vitamin. It's a water soluble vitamin, and the most important factor that needs to be remembered here, that human body is incapable of producing vitamin C intrinsically. So that is because the human lacks an enzyme which is known as L-gulonolactone oxidase. So, because of the mutation in the gene coding for that enzyme, human beings are devoid of this enzyme, and hence, since this vitamin C is not being synthesized in the human body, we need to take a dietary supplementation to cater to the needs, to cater to the vitamin C requirement of the body. So, say for suppose if the dietary supplementation is not enough, and the body is not getting enough vitamin C as it needs, so that will definitely lead to the deficiency of vitamin C, which is a condition called as scurvy, right? So when do we say that a patient has scurvy? So to call the condition as scurvy, there has to be a chronic deficiency of vitamin C for at least 3 months of duration, right? So there has to be at least 3 months of a chronic deficiency of vitamin C in a patient, and also the body pool, that is the amount of vitamin C which is being taken into the body, it is less than 350 milligram, right? So if we have these two conditions, then we can say that okay, this patient is suffering from scurvy. Then again, if there is less consumption, and along with that, if there is less absorption of vitamin C. So as we know that vitamin C is getting absorbed in the small intestine. So if there is less consumption or even less absorption of vitamin C, in that case also it might lead to scurvy. Now, the most important thing is clinically, scurvy has got very characteristic features. But then again, these features might also overlap with different other disorders. And since scurvy is rare and it's seldom suspected, so because of all these reasons, a lot of times scurvy goes unnoticed, right? Okay, so In the middle panel, as you can see, an animal pathway. So this mentions that the as we have just discussed about vitamin C being vitamin C not being not being synthesized in the human body. So in the animals, this enzyme which is responsible for the yeah. So as you can see in the animals, this gulonolactone oxidase is the enzyme which is required at the terminal stage for the synthesis of ascorbic acid from glucose, right? But as we have just discussed that this enzyme is absent in humans, so this conversion from glucose to ascorbic acid is not possible in humans. So please remember this. And then, as we have also discussed, that why do we say that a specific clinical condition is scurvy, right? So we need to remember that the chronic deficiency has to be at least of 3 months duration, and the body pool of vitamin C is less than 350 mg. Now, with all these information, it is also important for us to know that which are these children who are at a higher risk of developing scurvy, or who are uh, more predisposed to this disease or the deficiency of vitamin C. So, for example, if children are fed with predominantly high treated or ultra high temperature or pasteurized milk, yeah. So, in this case, what happens? The required vitamins are not there in the milk. Or, say, for suppose if the child is being fed with unfortified formulas, right? So, in these cases, also the formula or the milk that is being fed to the baby, so that is devoid of vitamin C. Now we all know that fruits are the major source of vitamin C. So say for suppose a child is also not eating fruits or not receiving fruits, and not even having fruit juices. So in that case also, the child has a greater chance of developing scurvy, right? Now, uh, next, say children with restricted diets. So there might be a lot of children with different clinical disorders, for example autism or cerebral palsy or other disorders, because of which their diet needs to be restricted. Or say on children on total parenteral nutrition, they are not able to take foods with their mouth, and they have to be given total parenteral nutrition. So in this case, their nutrition is already compromised, and they are also at higher chances of developing a severe vitamin deficiency, which in this case is a vitamin C deficiency or scurvy. Again, severe malnutrition is also a major cause for children to develop this kind of deficiency. So, this is very important to be kept in mind, that who are the individuals who are at a higher risk of developing this disease, right? Now, next, if we talk about the symptoms of scurvy, so we have come to know about the cause of the disease, the the predisposition of the disease, and now what are the exact symptoms of the disease. So, as we can see, that in scurvy, one of the most common symptoms is the bleeding of the skin and mucus. So, say there is, you can see a bleeding, you can see there are bleeding spots on your skin, and then the lining of your mouth, you can see there is bleeding in your gums and inside the mouth. Number two, gingivitis, loose teeth. Gingivitis means inflammation of the gingiva or the gums, along with loose teeth. So, this is also a hallmark characteristic of scurvy. Number three, rough and dry skin. So, scurvy also comes with different dermatological manifestations, right? Next, we can have joint and body aches. So, that definitely also impacts the skeletal system of the body. Now, we have fatigue and depression. So, this also impacts the mental health of the patient. increase susceptibility to infection. So the deficiency of vitamin C is also impacting the overall immunity of the human. And then there is also muscle weakness. So on the right hand side, as you can see, this is a paper which has been published in the journal Pediatric Rheumatology. So in this paper, um, these images that we see, these are very um, characteristic features of scurvy. So in image A, as you can see, there is knee flexion contractures. So there is a skeletal change or a skeletal manifestation of that gets which is evident through the knee flexion contractures here. And you can also see ecchymosis. So ecchymosis means the bleeding that has happened here. So the bruised areas, the bruises that you can see here, these are called the ecchymosis. So of course, since we are seeing some skeletal manifestations and we are seeing some bruises under the skin, so we can say that this disease has got it impacts the skeletal system, and also the it also has hematological, that is blood related manifestations, right? Now second, we can see there is hyperkeratosis. So hyperkeratosis means thickening of the skin, and we have also seen that scurvy also presents with rough and dry skin. Along with that, we can see something called as follicular purpura. So follicular purpura is especially these bleeding spots which are seen at the base of the follicles, the hair follicles that we can see here, right? And with corkscrew hairs. So corkscrew hairs are very characteristic of scurvy. Um, the intertwined hair that can be seen generating from the follicles, these are one of the characteristic features of scurvy, dermatological features. So in C image, we can see that there is something called hemorrhagic gingivitis. So in easy words, this hemorrhagic gingivitis refers to the inflammation of your gums and also the occurrence of bleeding gums. So inflamed gums and bleeding gums, these are the most important oral manifestations of the scurvy disease, right? And here we can see a very interesting thing that has been shown by this black arrow, which is called neurotic excoriations. So neurotic excoriations, they refer to um, something which is a psychodermatological disease where the patient has a tendency to pick his or her own skin. So it is a psychological manifestation which leads to a recurrent picking of your skin, and because of that there is a subsequent trauma that can be seen here. So there is a bleeding spot here also, which has been induced because of the self picking, the self skin picking tendency, right? So as we have seen regarding scurvy, so scurvy is caused due to the deficiency of vitamin C, how our body is unable to synthesize the required vitamin, and hence the dietary supplementation of this vitamin is so necessary for our body. And then because of deficiency, the scurvy is formed, and which children are more predisposed to the occurrence of scurvy. We have come across the symptoms of scurvy and also seen the different clinical pictures that have been reported in patients with scurvy, right? So I think I have been able to clear some of the doubts that you might be having related to scurvy. And in case you want to read more, you can always go through the sources that have been mentioned here. And you can also put in your queries in the portal if you have more queries regarding a specific topic. So next we would discuss about the amount of iron which is available in breast milk. So somebody also had a query regarding the amount of iron which is available in breast milk. So here it is to be um, established, the fact needs to be established that iron in breast milk is found in very low quantities, in very low levels. So here we can say it is estimated at around 0.35 milligram per liter. So we know that most babies are born with enough iron stores to meet their needs for the first 6 months of life, right? So this iron store establishment is also related to three very important factors, which is the gestational age, that is the period of the pregnancy, which refers to the gestational age. Then we have the maternal iron status. So, this is a very important factor where the mother needs to have a proper um, the mother needs to have a proper iron status, and because of which during pregnancy the mother is always advised, or the pregnant women are always advised to take an iron rich diet along with folate and iron, the iron and folate tablets, right? So the maintenance of the maternal iron status is very important to create these iron reserves in the child. So these iron reserves that will be formed in the child is very important for their initial growth and development that happens in the first 6 months of life. And the third factor which is important here is the timing of the umbilical cord clamping, right? So we'll be learning about the timing of umbilical cord clamping and what are the advantages. I am sure most of you have already gone through the lectures and completed your assignments. So I am assuming you are familiar with the concept of umbilical cord clamping. So here we'll go through the basics of these topics once again, and why the timing of the umbilical cord clamping is so important to maintain the iron reserve in a newborn, right? Okay, so after the 6 months, what happens now? Since these iron reserves that were there in the first 6 months in the child, so now in little by little, these iron stores have been depleted, right? So now this iron has to come from some source, and what is that source? So that is called complementary feeding, as we have discussed in our previous sessions also. So initially the mother is feeding the child with only exclusive breastfeeding, and at that time when the child is fed only with exclusive is fed with only breast milk, so at that time the child already has iron stores which is taking care of its growth and development, right, in the first 6 months. But after those first 6 months, now these iron stores have been depleted, as we have just seen, and they need to be substituted with other complementary foods in addition to breast milk and formula, right? So as we can see, there are different recommended daily intakes in case of different ages of children, in females, in adult males, and in females. So please go through these daily intake values and make it a point to remember these. And here we also should remember that iron is one of the most important factor which is responsible for the cognitive function of the child, the motor functions of the child, the attention and the behavioral patterns of the child. So hence the contribution or the role of iron in child growth and development is very significant, right? So though the so since breast milk has very low iron amount, hence it is also very important to give the child the proper or the required adequate amount of iron through the diet, or also through iron and folate supplements, right? Okay, so next we come to another query. So somebody had asked, what are the causes of low hemoglobin levels in pregnancy in spite of deworming and 180 iron folate tablets, right? So, as we have come to know that during pregnancy, obviously there is a high demand of blood. So, since there is one more living being which is growing inside the body of the mother, so there is obviously an increased demand for blood. And if the mother or the pregnant woman is not getting adequate iron in her diet, then it increases the risk of iron deficiency anemia. So this iron deficiency anemia is a very common occurrence in pregnancy, and because of this, the mother or the pregnant women, they need to be given iron folate tablets and also deworming tablets, because um, parasite infestations have also been seen in the pregnant ladies, where this might also lead to the decrease in iron in the body. So if there is decrease in iron in the body, this again predisposes the occurrence of iron deficiency anemia, which is definitely not a very favorable situation for the growth of the child, right? Now, these are the two most important ways as to how we are trying to um, we are trying to maintain the recommended or the required level of iron in the body of the pregnant women. But still, there might be some cases where, in spite of giving deworming and iron tablets, it might be seen that still there are low hemoglobin levels in these pregnant women. So that might be attributed to the different molecules which are present in the human body. Say, for example, ferritin. So, ferritin is a protein to which, when iron gets attached, it helps in the oxygen transport in the body, right? And erythropoietin, it also, with the help of iron, it helps in the formation of RBCs or red blood cells. That is the erythropoiesis. Now, as we have just discussed, that even on taking iron and deworming tablets, if we see that there is still persistent hemoglobin there is still persistent low hemoglobin levels, then in that case, indicators like these need to be tested through various biochemical tests. So this might happen that maybe the serum ferritin is low, or the erythropoietin is low. So if these molecules are defective in the body, so that might not lead to the proper absorption of the body the proper absorption of iron in the body. So it might happen that we are trying to give iron supplements all throughout, but in spite of taking that iron, if that iron is not getting absorbed into the body, of course that doesn't serve the purpose, right? So this is to be kept in mind, that in spite of giving the supplements, if we see that there is still persistent low hemoglobin levels, then factors like these should also be taken into account, right? Okay, I hope I have been able to clear this doubt. Okay, so next, yes, is anybody saying something? Okay. So, next query was regarding tamarind, whether it is a good source of vitamin C or not. So, regarding tamarind being a good source of vitamin C, there have been some um, there have been some papers which have sorry which have looked upon um, the content of different vitamins and the content of different vitamins in tamarind. So, say for suppose this paper, which has been published in the journal Fruits, here they have mentioned about the contribution of 100 gram of the pulp of tamarind, which, when supplied to children, pregnant women, and adult men, they have shown to suffice at least um 19% of vitamin C requirement in children. So, as we can see for vitamin C in children, at least 19.16% of intake adequacy is obtained. Then again, 5.32 and 5.63 percentage of the vitamin C requirement could be obtained in case of adult men and pregnant women, right? So we can say that the from tamarind, a decent amount of vitamin C intake could be substituted. Now, in case of vitamin E, as we can see, the numbers are really low, like 1.32 in case of children, 0.61 in case of adult men, and 0.73 in case of pregnant women. So, definitely, tamarind is a very poor store of, or a very poor source of vitamin E. And on the contrary, we can see that tamarind is also a really good source of folates, because in case of children it is substituting for at least 29.68 percentage of the recommended intake, or the recommended amount for folates. In adult men, it is sufficing for around 14.84%, and in pregnant women, it is also sufficing for around 9.89%. So, through this, we can say that tamarind is, of course, a very good source of vitamin C and folates, but on the contrary, it is not um, not a superior source of vitamin E, right? On the other hand, there is another paper which has been published in the Journal of Food Science and Nutrition. So this paper, it shows that the different parts of the tamarind was examined. They have examined the pod, they have examined the pulp, and also the seeds. So when they have analyzed these, they have seen that the pulp contains a higher vitamin C or ascorbic acid than the seed samples, right? So here the pulp was found to contain more amount of vitamin C than the seed samples. However, when they analyzed the seeds, it was seen that the seeds contain more amounts of beta carotenoids than pulp samples, right? So if anybody is interested, you can always go to these sources and read more about it, right? So I think I have been able to address the query regarding the tamarind being a source of vitamin C, right? Okay. So next we will move on to the concept of cord clamping. So we have just discussed about the cord clamping being the required mechanism which is very important during childbirth, that establishes the maintenance of circulation, that is the blood flow in between placenta and baby, right? So if um, there is immediate disruption of blood flow between the placenta and baby after birth, then of course it will lead to a decrease in the hemoglobin levels, and also that won't allow the baby the chance to get his or her own iron reserves, right? So for this, something called as delayed umbilical cord clamping is done. So first, let us go through early cord clamping. So if we talk about the time for the ideal time for cord clamping, so this has a varied opinion where people have different opinions regarding the ideal time for cord clamping. So if we consider the early cord clamping, so this is carried out in the first 60 seconds after birth. So this is usually done within the first 15 to 30 seconds, right? And the more common one, which is the delayed umbilical cord clamping, it is carried out more than 1 minute, sorry. It is carried out more than 1 minute after the birth, and this is also done when the cord pulsation has ceased. So, for delayed umbilical cord clamping, so either it is done after 1 minute after the birth, or it is checked whether the umbilical cord is still pulsating, and when the pulsation has stopped, then it is the cord is clamped. So as we can see that in this image on the left hand side, there is a cord which has been cut and clamped immediately, and we can see a huge amount of blood within the cord, right? And in case of delayed clamping, there is much less amount of blood within the clamped cord. So this delayed umbilical cord clamping is important, as we have just discussed. So apart from early cord clamping and delayed umbilical cord clamping, so this paper by Indian doctors, it also talks about how delayed cord clamping till the 5 minutes after delivery has also been shown to be beneficial for oxygen saturation and heart rate transition. So, apart from the time uh, span of say 60 seconds after birth and more than 1 minute after birth, till 5 minutes also, people have advocated that delayed cord clamping till 5 minutes also have been found to show superior placenta delivery, right? Beneficial placenta delivery. So, just to emphasize again on the importance of delayed cord clamping, so this enables the proper circulation of blood in between the placenta and the baby after birth, and this is a major phenomenon which ensures that there is proper increase in hemoglobin levels in the baby at birth, and this will also ensure that the baby has his or her own iron reserves in the first 6 months, as we have discussed. So for the first 6 months the baby has adequate iron reserves, which helps the baby to grow um, favorably, right? So it improves the iron stores in the first several months of life, which may have a favorable effect on developmental outcomes. So this iron, as we have repeatedly stressed on its importance, that iron is definitely most important for the growth and development of the baby, and definitely delayed umbilical cord clamping is one of the major phenomenon which is required for these for maintaining the circulation between the placenta and the baby, right? Okay, so next we'll be talking about the ideal weight gain during pregnancy. So as we know that definitely weight gain during pregnancy is a very common occurrence. But of course, how much weight gain should be there and how much is an accepted range? So let us discuss about that. So according to the Ministry of Health and Family Welfare, under the Government of India, it is recommended or it is advocated that a weight gain of 9 to 11 kgs during pregnancy is acceptable. But here they haven't given any separate weight recommendation for overweight or obese women, right? So, as per the Ministry of Health and Family Welfare, 9 to 11 kgs is acceptable, right? Now, if we come to the weight gain recommendations for women by the Center for Disease Control and Prevention, so we can see that they have given weight gain recommendations for women pregnant with one baby and also with twins, right? So they have categorized the pregnant ladies into underweight, normal weight, overweight, and obese, and they have advocated the specific range for their acceptable weight gain during pregnancy. So, if we consider the weight gain recommendations for women pregnant with one baby, so as you can see in case of underweight women, so if the BMI is less than 18.5, so the mother can gain around 28 to 40 pounds. Now, if the mother has normal weight with BMI of 18.5 to 24.9, so the mother is um, capable of gaining 25 to 35 pounds. Now, on contrary to the recommendations given by the Ministry of Health and Family Welfare, the Center for Disease Control and Prevention also gives us the advocated ranges for overweight and obese mothers, right? So overweight pregnant ladies with BMI of 25 to 29.9, they can gain or they should gain around 15 to 25 pounds. And obese mothers with BMI greater than or equal to 30, they can also gain around 11 to 20 pounds. So, similarly, they have also advocated the weight gain recommendations for women pregnant with tweens. And similarly, they have mentioned as to how the underweight, normal weight, overweight, and obese mothers can have a specific range of weight gain. So, similarly, like Center for Disease Control and Prevention recommendations, the IOM or the Institute of Medicine in US, they also advocate a similar kind of the similar values of ranges of the weight uh, that the weight gain that happens during pregnancy. So, in case you want to know about the specific institute of medicine, the specific recommendations that have been given by Institute of Medicine, you can always go through the sources that are available on the internet. And as I have just said, that the Institute of Medicine also advocates the similar weight gain recommendations as the Center for Disease Control and Prevention, right? So we should remember the acceptable ranges and the ideal weight gain that can happen during pregnancy. Okay. So, just a follow up question. So, which of the following increases the risk of childhood obesity? Is it high weight gain in underweight mothers, high weight gain in mothers who are not underweight, low weight gain in mothers, and no weight gain in mothers? So, um, can anybody let me know the answer?
Option B, ma'am.
Okay, so it's high weight gain in mothers who are not underweight, right? Okay, so correct answer. So, mothers who are not underweight, now if there is suddenly a very high weight gain in pregnancy in these cases, so of course that increases the risk of childhood obesity, right? Okay, so next we come to the query regarding the quantity of sulfur in daily food. Okay. Yeah, I'll be discussing problems as well. After discussing all the queries, I'll be discussing the questions as well, the problems. Yes. Okay. So the quantity of sulfur in daily food. So as we know, there are four common sulfur containing amino acids, which are namely the methionine, the cysteine, the homocysteine, and the taurine, right? So, out of these four, these two are the most important sulfur containing amino acids because these are incorporated into the proteins that we usually take through our uh, diet, right? So, methionine and cysteine. Now, when we talk about the daily intake of sulfur, so as of now, there is no specific um, value that connotes to the uh, daily intake, the daily recommended intake of sulfur. But of course, um, if the daily allowance for sulfur amino acids is considered, then the Food Safety and Standards Authority of India, that is FSSAI, they have advocated that methionine and cysteine, they are required in age groups more than 24 months at in the amounts of 18 milligram per kg body weight per day. So the daily recommended allowance of methionine and cysteine is 18 milligram per kg body weight in case of children or in case of individuals more than 2 years of age. Correct? Okay. So, as we can see, these are the different sulfur rich food sources, and we know that allium vegetables like garlics and onions, these are a major source of sulfur in our diet. Okay. So, there was also a query regarding the excess consumption of onion. So, if there is an excess consumption of onion, there have been studies where the normal the normal adults have been found to show symptoms related to irritable bowel syndrome. So, the irritable bowel syndrome or IBS, it presents with pain in the abdomen, then abdominal cramps, bloating, flatulence, etc. And in case of pregnant or lactating women, as of now, there is no specific data is there that has been established. Um, yeah, which which says that excess consumption of iron, it causes some um, specific adverse effects in pregnant or lactating women. So it definitely needs more data to ascertain that. Okay. So next is muscle cramps and twisting of toes. So this is caused by which nutrient deficiency? So muscle cramps, they are mostly caused by the deficiency related to both macronutrients and micronutrients. So we can say that vitamin D and vitamin B12 are the most important macronutrients, the deficiency of which can lead to muscle cramps, right? And we know that vitamin D is, of course, a very important a macronutrient which is helping in the development of the skeletal system, right? So vitamin D and vitamin B12, they are the macronutrients which can lead to these muscle cramps and muscle aches, etc. Then coming to micronutrients, so these are very important micronutrients, namely calcium, sodium, potassium, and magnesium, that can lead to a muscle cramp. And also, all of us, we know that dehydration is also a contributing factor to muscle cramps, and it is advised that if a baby or an individual is suffering from muscle cramps and twisting of toes, so the along with these macronutrients and micronutrients, the patient or the individual takes in a lot of water, and along with these water, since these micronutrients will be taken, so these lead to the proper electrolyte balance in the body. So it is very important to take in um, the required levels of water along with the electrolytes. The electrolytes here are, they refer to the calcium, sodium, potassium, and magnesium, which are the micronutrients, and also the vitamin D and vitamin B12 need to be substituted through the diet, right? Okay. So, coming to the problems, 90% of brain growth occurs by which age? Can anybody please tell me the answer? Anybody?
Option B.
Okay. Anybody else? Okay. So option B, 5 years, is the correct answer. So as we know that a child's brain development, it starts very early during the um, pregnancy, right? So we know that almost 80% of the brain growth it occurs by 3 years of age, and 90% of the brain growth it occurs by 5 years of age. After that, there are specific areas of the brain that still keep on growing. So, as we can see, the brain, as we all know, that the brain has two major parts, the cerebrum and the cerebellum, right? So, the cerebrum or the forebrain, it is made up of uh, frontal lobe, the parietal lobe, occipital lobe, and the temporal lobe. So, here, as we can see, that the frontal lobe it handles all thoughts and voluntary behavior, memory, goal formation, abstract thinking, planning, and impulse control, right? Parietal lobe it is associated with bodily sensations. It controls the taste, touch, ability to recognize objects, and also the hand eye coordination. So these are also very important when the child is in his growth phase, right? Next is the occipital lobe. So occipital lobe it controls the vision and visual recognition, along with temporal lobe which controls the hearing, smell, language skills, and social understanding. So all these are very important for a proper growth and development of a child, and these the development is almost 90% complete by the age of 5. And also as we can see that the cerebellum is required the cerebellum is responsible for the balance and muscle coordination, right? Okay. So now as we can see that 90% of the brain growth occurs by 5 years of age, and also from around 10 years of age and above, the most brain changes serve to improve function of the more sophisticated and versatile frontal lobes. So as we know, the frontal lobe or the prefrontal cortex it keeps on growing even till the age of 25, right? And the frontal lobe is very important for motor function, problem solving ability, memory, language, and impulse control, right? So these are the different parts of the brain which serve different important functions, and all of them they cumulatively um, lead to a proper growth in the child. Okay, so next, which brain structure has a central role in emotional behavior? So, which brain structure has a central role in emotional behavior? Hippocampus, amygdala, anterior cingulate cortex, or dorsolateral prefrontal cortex? Anybody would like to answer? Please volunteer.
Option B.
Okay, option B, amygdala. Right. So, as we can see, if we consider the brain of the child, we can see four regions here which have very major specific functions. So here we have the amygdala. So this amygdala is in the temporal region. So as we have just studied, so this is the frontal region, this is the parietal region, this is the occipital region, and this is the temporal region of the brain. So the amygdala is a brain structure which is situated in the temporal region of the brain, and this is responsible for the emotional stress and learning. So whatever emotional behavior that we see in a child, so the amygdala is responsible for that development. So amygdala is responsible entirely for emotional stress and learning, right? We also have a structure called hippocampus. So this hippocampus is responsible for learning and memory. Next, we have the anterior cingulate cortex. So as we can see here, the anterior cingulate cortex is responsible for the selective attention and social interactions. So how social your child is, that is decided by the anterior cingulate cortex, because these are the regions in the brain which will motivate your child to have social interactions, to have proper attention. So these are the contributing factors of the anterior cingulate cortex. Now we come to the most important, dorsolateral prefrontal cortex. So this um, area in the brain, it is a very important site of the brain, or it is a very important brain structure, because in the frontal lobe we have a lot of areas which relate to speech, which relate to writing, which relate to other cognitive functions. So these are very important for the all over growth and development of the child. So this dorsolateral prefrontal cortex, it deals with the motivation and different executive functions of the child. So please remember the different the different kind of roles which are being taken up by the different the structures in brain. So these are important, as we have just discussed, as to how the child, as to how the brain in a child develops and how that completely impacts the early childhood of a child, and also the subsequent years of his life that he spends, right? Okay. So now we come to another question. So what condition does the image suggest, right? So here we can see this is the vertebra, right? Or this is the spinal cord. And we can see here a pouch-like thing which has ejected out from the spinal cord, and this is the vertebra, and the spinal cord has ejected out in a pouch like fashion, correct? And here we can see the spinal fluid, and this is the dura mater, or the covering of the spinal cord and brain. So what condition does the image suggest? Here we can see this um, uh, this opening which might corroborate to this image. So, what are these? If we consider the development of a child, so the child is developing from a structure called the neural tube, right? So, the neural tube, it has got an anterior portion and a posterior portion. So the anterior portion of the neural tube, it is developing into the brain, and the posterior portion of the neural tube, it is developing into the spinal cord, right? So what might lead to occurrences like these? So these, if this neural tube while development, if there are some um, nutritional deficiencies, or there are some reasons due to which the defects are formed, so these give rise to the neural tube defects. And these neural tube defects are, say for example, because of the less consumption or less absorption of key nutrients which are required for early development of the baby's brain and spine. So these are folate, vitamin B12, and choline. So if either of these three, say they are not available in the mother's diet, or the mother is chronically deficient of these nutrients, so is um, the child has greater chances of developing these neural tube defects. So the condition that we are seeing here, it is called spina bifida, which is a spinal cord defect. And if the defect, it happens in the brain or in the anterior region, so then it is called anencephaly. Okay, so the neural tube has got an anterior region which will grow into the brain, and the posterior part which grows into the spinal cord. In case the neural tube defects is in the brain defect, it happens as a brain defect, it is called as anencephaly. And if it occurs as a spinal cord defect, it is called spina bifida, correct? And please keep in mind that these three are very important nutrients that are absolutely um, important, or that are absolutely indispensable for the early development of baby's brain and spine. So folate, vitamin B12, and choline, right? Okay. So, which of the following plays a role in fetal cell development and DNA synthesis? So, we have just read about the key nutrients that lead to the growth of the fetus, right, through neural tube development. So, here folate is one such important vitamin that leads to fetal cell development. So, the answer to this question is vitamin B9, which is folate or folic acid. And we have seen how it helps in fetal cell development. But another important another important role of folate is also in DNA synthesis and DNA repair. So as we can see that the folic acid or the dietary folate which is being taken in into the body, it reacts with the different it changes, it gets changes sorry it changes to the different derivatives of folate, and then it causes the methylation of uracil to form thymine. So as we can see, these are the nucleotides which are formed which are there in the body. So this uracil, when is methylated with the help of folate, it leads to the synthesis of thymine, and this thymine leads to DNA synthesis. So of course folate is one of the most important micronutrient which is macronutrient which is responsible for fetal cell development and DNA synthesis along with DNA repair. One more thing that needs to be kept in mind, that folate here, it also regulates the formation of the methionine the formation through methionine and homocysteine. It helps in the formation of methylated DNA, RNA, protein, and lipids. So these are the macronutrients which are being formed uh, with the help of folate. Correct? Okay. Now next we come to which good fats are present in breast milk. So when we talk about fats, these are good fats, or these are good fats or um, unsaturated fatty acids which are present in uh, breast milk, right? In food. So when we are talking about good fats in breast milk, these are two omega-3 fatty acids that are present in breast milk, which is the eicosapentaenoic acid and the docosahexaenoic acid. So EPA and DHA, they are very important omega-3 fatty acids that are present in the breast milk. And apart from that, there is one more important omega-3 fatty acid also called as ALA, or alpha linolenic acid, right? Now these two omega-3 fatty acids, they are present in breast milk, and while the mother is breastfeeding the baby, so these nutrients, they are also transferred to the baby. And these omega-3 fatty acids, they are responsible for brain and retinal development or eye development. So as we can see, brain and eye, so obviously these omega-3 fatty acids are very important for the baby's development. Now when the mother is feeding the baby, so of course the mother's omega-3 fatty acid reserves are being transferred to the baby. So to maintain the lactating mother's fatty acid levels, it is very important that the lactating or the nursing mothers should also consume good fats. So where do we find these good fats? So for non-vegetarian people, of course, fish is a very important source or a very major source of good fats or omega-3 fatty acids. But for vegetarian people, nuts and seeds. So it needs to be kept in mind that nuts and seeds are major sources of omega 3 fatty acids, right? So it is very significantly, it is significant that the lactating or the nursing mothers also keep on taking their daily source of omega 3 fatty acids or good fats from fish, nuts, and seeds to maintain their own levels of omega 3 fatty acids, right? And also, during pregnancy, when the myelin sheath is formed, like as we have already studied, when the neurons are forming, so at the early stages of pregnancy, the myelin sheath is formed over these neurons, which are responsible for the conduction of the signals. So, this myelin sheath, for the formation of this myelin sheath, fat is required. So that fat, it also comes from the good fats in the mother's diet. So of course, whenever we are talking about fats, it doesn't mean that always fat is detrimental to the health. We should keep in mind that every food, when taken in moderation, it has got a beneficial effect. So even if uh, nuts and seeds have omega 3 fatty acids and good fats, if it is not taken in optimal amounts, it can have detrimental effects. So, all the food and all the food sources, they have to be taken in proper amounts and in moderation. So, as we were discussing during the formation of myelin sheath, also, the mother should have a proper intake of good fat through her diet, right? Okay. Next, what will you do if anybody complains of black stools on taking iron and folic acid tablets? Okay, so stop the supplementation right away? No. Inform and reassure the patient. Substitute with other drugs, scare away the patient. So, of course, it is pretty much evident from the options that inform and reassure the patient is the answer. But what is the reason why the patients can complain of black stools? So of course, when pregnant women are taking iron and folic acid tablets, it is a very common occurrence that they might uh, start seeing black colored stools. So it is the responsibility of the healthcare provider that they tell them that this is a very minor side effect that happens when taking iron and folic acid, and there's no need to get concerned regarding it. And also, this needs to be communicated to the pregnant mothers or the individuals taking these medications that they should not stop because of these side effects, and they should continue their regimen. Otherwise, the the uh, the cause for giving these medications would not be fulfilled, right? So it is very important that we inform the patient that why they are getting these black stools, and also simultaneously reassure the patient that they shouldn't stop their regimen. They shouldn't stop their regimen because black stools or constipation, these are if some minor side effects are there, they should inform the healthcare provider, and accordingly they should keep on continuing their medications. One more important information that I would like to give here, that sometimes what happens, these medications, they have some active reagents of bismuth salicylate. So this bismuth salts, they often give the black tar like appearance to the stools. So this is one of a common cause of the black appearance of the stools on taking iron and folic acid tablets, right? One more thing that needs to be kept in mind when we are discussing about iron and folic acid tablets is that whenever we are prescribing iron and folic acid tablets to make the absorption of iron more um, to make it the absorption higher, the rate of absorption higher, it should always be given with vitamin C sources. So along with iron and folic acid tablets, vitamin C should also be taken. Vitamin C tablets or vitamin C sources like lemon or citrus fruits, these should always be taken to increase the rate of absorption of iron and folic acid. But if calcium supplementation is also given with iron and folic acid, then um, the patient needs to be informed properly that these two medications should never be taken together. If the patient is taking iron and folic acid in the morning, then the calcium medication should be taken at least 1 or 2 hours after taking the iron and folic acid, and then again in the evening. So calcium, it messes up with the absorption of iron and it reduces the rate of absorption of iron. So hence, when taking iron and folic acid, vitamin C increases the absorption of iron, so it should be taken together, and calcium reduces the absorption of iron, so it is better to avoid calcium medication along with iron and folic acid tablets, right? Okay. So, next question. Ideally, a mother's diet must include at least how many food groups? So, I am assuming all of you have already gone through the different food groups that are required for a mother's um, body. So there are a total of 10 food groups, and out of those 10 food groups, a mother's diet should at least include 7 food groups. So if the mother is capable, or if the mother is able to eat um, to incorporate food from 8 or all the 10 food groups, then nothing like it. It is always beneficial to have a proper diet for the mother as well. But at least 6 groups of food should be there in a mother's diet. Now, coming to the babies. So, as we can see, for the babies, there are 8 specific groups of food that have been advocated. So, number one, obviously, breastfeeding. Number two, we have legumes and we have roots. Number three, um, we have nuts and seeds. Number four, dairy products. Number five, fishes. Number six, eggs. And number seven, we have other vegetables. And number eight, we have fruits. So for the babies, it is important to provide the baby with all the eight. Out of eight, all the 8 groups of food should comprise the baby's daily diet. So, for a beneficial diet for the baby, so from each of these groups, representative food should be present for the baby's diet. So, please keep in mind that out of the 10 food groups for a mother's diet, at least 6 should be present. And for the babies, out of 8 food groups, all 8 food groups should be present for the proper growth of the baby. Right? Okay. So, next, um, delayed cord clamping is followed by early cord clamping, complementary feeding, breast crawl, keeping the baby away from the mother. Okay, so the answer to this is breast crawl. So let us go through the options. So delayed cord clamping is followed by early cord clamping. Obviously, this option doesn't make any sense. Number two, complementary feeding. No. As we know, complementary feeding is, of course, a phenomenon that happens after the 6 months of age. Breast crawl and keeping the baby away from the mother, also, this option doesn't make sense. So, breast crawl is something which is followed by the delayed cord clamping. Now, after the delayed cord clamping, so the breast crawl is a phenomenon or is an instinctive movement of the newborn child towards the nipple of the mother for the purpose of latching on to initiate breastfeeding. So, as we have already discussed in our previous sessions, the initiation of breastfeeding is very much important within the first hour after birth. So, this is possible through the breast crawl. So, the child crawls on the chest of the mother, and then it moves towards the nipple of the mother for the purpose of latching on, as we have discussed, to initiate breastfeeding. So, this breastfeeding is, of course, the initiation breastfeeding, which is done with the help of providing the colostrum or the first milk to the baby, right? Okay. So this was the last question for today's session. So thank you. And anybody of you have any questions? If you have any more queries, you can always put them in the portal. So as I have already directed you, so when you go to the SWIM portal, there is ask a question in the course tab, and you can always put your questions related to the the course material or the sessions, and we'll get back to you with your queries. And if you have any suggestions as to how the subsequent sessions can be taken, you can always let me know that. Any questions? Okay, so I'm supposing there are no more questions for today. So we will meet on next Tuesday from the same time, and we'll be discussing more concepts related to the week 5, and also discuss the model questions which will be helping you people with the following assignments. Okay, thank you.